welcome to another episode of the She Health series. My name is Dr. Sida Ekanem, and today I'm going to be talking about how to do a self-breast examination. Before I proceed, let me just mention at this point that the self-breast examination does not replace your annual checks or your breast scans, but it has been found to be very useful. And if you want to know more, then stick around. Hello there, welcome once again to this episode. Now we're going to be diving straight into the topic for today, how to do a self-breast examination. The self-breast examination is simply a step-by-step procedure to examine your breast, usually done at the comfort of your home. Remember at the beginning of this video, I had said that a self-breast examination does not replace your routine breast scans or routine clinical assessments by your doctor. But it's very important because it helps every woman know what is normal for them. Usually the breast tissue can be lumpy or dense, but for a woman who does a regular self-breast examination, she will identify what is abnormal from the usual and thereby seek care as early as possible. Now, next things, when do you do a self-breast examination? Self-breast examination is done usually for women who are menstruating about 2 to 3 days after your normal periods, and for women who are postmenopausal, no longer seeing their periods, any scheduled day of the month is fine, as long as it is done and it is a routine. It's quite easy to do a self-breast examination and it takes just about a few minutes. Now, first thing you want to do, you want to stand in front of a mirror, standing bare from your neck all the way down to your waist. You're going to be examining your breasts with your eyes, just visually, with your hands raised like this, with your hands on your waist, tilted forward to tense your chest muscles, and with your hands by your side, as you can see in the diagrams I have attached to this video. Now, what are you looking out for standing before a mirror? The first thing you want to note is the size of the breast and the contour. Because it's a paired organ, there too, you want to compare one breast to the other. Are there any marked differences in the sizes? Check for darkening or reddening of the skin. Look out for rashes, ulcers, or look out for dimpling of the skin or any change in the direction of the nipple. These are the things to look out for when you're visually inspecting your breast before the mirror. The next thing you want to do is to feel for the breasts. Now, usually in feeling for the breast, the right hand is used to examine the left breast and the left hand is used to examine the right breast. Like I'll demonstrate. So when you want to feel your breast, with your hands above your head and the palm of your fingers, you will just examine your breast using up and down motions or circular motions. Now, look at what I'm doing. All right. One, up and down, up and down, up and down. Make sure you feel all the way to your armpit because some of your breast tissue can be found there. Still with the palm of your hands, you're going to do circular motions, one just around the breast tissue, and you're going to repeat the same for the other breast. You're going to be making these motions slightly, and you're going to be doing them firmly as well. Doing firm motions or firm feeling of the breast will help you pick out lumps or any swellings that you may not have picked when you just examined lightly. Next thing you're going to do is you're going to lie down flat on your bed with a pillow, if you may. Just like you did when you were standing, with your right hand behind your head, you would go ahead to examine your breast using up and down motions and circular motions like I have previously demonstrated. Make sure that you feel for your breast all the way to the armpit region. And this will help you pick up any lumps or swellings. And that is all for a self-breast examination. Let me mention at this point that not all lumps that one feels during a self-breast examination is a cancer. That is why, like I said before, the self-breast examination does not replace your routine breast scans or routine clinic visits with your doctor. Doing a self-breast examination is just simply self-care, making sure that you're able to pick any abnormalities which is different from your usual. And by that, you can always seek attention if anything goes wrong. I have come to the end of this video. Now, if you found this video helpful, please do the following. Subscribe to my channel, like, leave a comment, share this link to as many women as you know, and also click on the notification button so that you'll be alerted anytime I have a new episode. I'm Sita Ikanem once again, and I'm signing out. Thank you for listening. Bye now.